Hi guys, the most dreadful things in poultry farming are poultry diseases. When it comes to poultry farming, that is what most poultry farmers are scared of, diseases. There are some diseases that when they affect your flock, they can wipe out the whole flock. Sometimes even in the night, you can wake up the following morning and discover that the whole flocks are gone. Okay, and also some will cause poor production for you in terms of meat beds. You can have stunted growth, right? And also in terms of laying beds, you can have a drastic reduction in the egg production. So knowing these diseases and how to identify them and how to prevent them and how to treat them is very important when it comes to poultry farming. And that is what we are going to be discussing today. I've been a victim of this. I have lost over 40 birds in the night, and I've heard of people that have lost 800 birds before. So it is very dangerous having these diseases on your farm. So in today's video, we are going to be discussing these common poultry diseases, okay, so that you will be able to identify them, know them, diagnose them, and prevent your chickens from having these diseases. Hi guys, this is Oche from Broiler Farms. I'm a passionate farmer and engineer in the Middle East, and I farm in Nigeria, Port Harcourt. Okay, I'm not in the location where my farm is, and I've been running a profitable broiler farm in Port Harcourt, Nigeria. This could be done because I have put systems in place on my farm in Nigeria. Okay, so if you want to learn more about how I'm able to do it, then there are a lot of videos on this channel that you can watch. And don't forget to subscribe to this channel because I've been sharing great content with you guys when it comes to poultry farming. Okay, so in today's video, I'm going to be discussing poultry diseases. And without further ado, let's go to the video straight away. Okay guys, you're welcome to my screen. I'll be sharing my screen with you guys. Okay, so like I told you before, this topic is very important. Don't take it lightly at all, because the health of your bird matters. You can either lose all your birds or you can gain very well from your poultry business if you know about the health of your birds. Okay, so this document, I'll be leaving a link for you in the description below where you can download this document for free. I'm not charging anything for it. It's free. Okay, you can download it, you can share it with your friends, whatever. It's free. Okay, so in this section, I'll be using this document, and I wanted to add some pictures to it, but I discovered it's not necessary to add pictures because most of the ailments have similar symptoms. So putting pictures could be deceptive. That's why I did not put pictures. So as you study this manual and you study the symptoms, you'll be able to identify some of them. Okay. So in this section, we shall be discussing the common poultry diseases. Having knowledge of these common poultry diseases will help you improve the well-being of your flocks. There is a wide range of diseases that affect poultry birds. However, we shall be discussing only the diseases that are often experienced on our farms. You may not need to bother yourself about the less common ones because they hardly occur on the farm. Okay, so we'll leave that for the vets to handle. Okay, so we shall be looking at the causes, the species that are affected by these diseases, the clinical signs, the treatment, and the prevention. In order to help us understand these diseases, I classify them into two broad categories. I classify them into respiratory and non-respiratory diseases. The respiratory diseases are those that affect the respiratory tracts of the poultry birds, while non-respiratory diseases do not necessarily affect the respiratory tract. Okay, then we shall also classify them based on the type of microorganisms causing the diseases, right? So that is it a viral disease caused by a virus? Is it a bacterial disease, or is it a parasite disease? That is a parasitic disease. Okay, so let's jump into it immediately. So part one is viral respiratory diseases. So in this section, we shall discuss viral diseases that are affecting the respiratory systems. So that is viral respiratory diseases. Okay, then the first disease on our list is fowl pox, and this fowl pox is also known as sorehead or bed pox. Then we should not mistake this fowl pox for chicken pox that affects human. Chicken pox is different. Chicken pox does not affect poultry, and fowl pox does not affect humans. Okay, so you need to have that in mind. Then we talk of the species that are affected by fowl pox. We have chicken, we have turkey, we have ducks, we have quails of all ages. It would affect them no matter their ages. Okay, then the clinical signs. There are two types of fowl pox: the dry fowl pox and the wet fowl pox. And this classification is based on where or the organs that they are affected, right? The dry type forms lesions, that is sore, dry sore around the unfeathered area. It could be the head, the legs, or the vents. Okay, now it can cause weakness. You see them putting their wings together, close together in a coat-like posture. Then it can cause retarded growth, it can cause stunted growth. Then in terms of laying birds, it will cause decline in egg production. Then there is a wet type, which affects the internal organs, especially the mouth, the pharynx, the larynx, the trachea. All those are the organs from the mouth down to the throat, down to the lungs. So those are the organs that are listed there. This obstructs the upper air passage. These one are the lesions that are formed in the mouth, and these other organs will block the upper air passages, thereby obstructing breathing. Okay, now we'll go to the transmission. It can be transmitted through direct contact between infected birds, that is bird-to-bird transmission. Then also mosquitoes are the primary spreader and reservoir of fowl pox, right? The mosquitoes are infected when they feed on the blood of birds that are infected with this fowl pox. So the mosquitoes are carriers, okay? They are infected and they transfer it from one bird to another as they continue feeding on the blood of your birds in your flock. Then treatment. No treatment available. Most viral disease doesn't have treatment. So for fowl pox, there is no treatment. So in case someone tell you he has a treatment for fowl pox, I've heard it before. I've heard it on a YouTube channel that they have a treatment for fowl pox, a herbal treatment. I wonder how true that is, but I seriously doubt if it will work. Okay. Then prevention is to keep mosquitoes away from your farm. Kill mosquitoes around you. Then there is also vaccination for fowl pox, and this vaccination is given in the wing web of the chicken. If it's a chicken, it's in the wing web, and if it's a turkey, it's on the thigh of the turkey, and they give them this vaccination when they are 8 weeks and older. Okay, so that is for fowl pox. I hope it helps you. Then the next one is Newcastle disease, which is a very common disease in poultry farming. It is also called ND or NDV, that is Newcastle disease virus. Then the species that are affected by this virus, we have all birds are affected by this virus, and it can also affect human beings. It can cause flu and conjunctivitis in human beings, right? The clinical signs, there are 3 forms: mildly pathogenic, also called lentogenic; moderately pathogenic, also called mesogenic; or highly pathogenic, also called velogenic. All these are not necessary, seriously, right? So let's move on. The velogenic form attacks the internal organ and are very deadly. That is the highly pathogenic ones, the deadly ones. Okay, it attacks the internal organ and it is very, very deadly. Then the mortality ranges from 10% to 80%, depending on the Newcastle disease that your bird have. Okay, the signs can include watery discharge from the nostrils, harsh chirps and breathing. You hear some sounds when they are breathing. When they are together, you hear some kind of chirpings. Quick, 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 quick. You know that sound? Quick, 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 quick. It will not be as smooth as it used to be, right? They'll find it difficult to do that. So that is one of the signs. Then labored breathing. You see them gasping for air. It will be difficult for them to breathe. They'll be opening their mouth, struggling, raising their throats, trying to breathe. Okay. Then facial swelling. You see faces being swollen. Then paralysis, trembling and twisting of the neck. That is when the virus has affected the central nervous system. Okay. Then decrease in feed and water consumption. Then when it comes to egg-laying birds, there is a dramatic drop in egg productions. Then how is this Newcastle being transmitted? It is transmitted airborne through a very short distance. Then also it can be transmitted through introduction of contaminated shoes, caretakers, that is your poultry keeper. Then feed deliverers, people delivering food for you, they can feed for you, they can bring the disease to your farms. Visitors, tires of vehicles, dirty equipment, feed sacks. You can imagine feed sacks is also listed here, so be careful how you feed your birds. Some people go with the sack inside the feed house. Please avoid that practice. Don't go with the sack inside your feed house. Take the quantity you want to take, put it in a container before taking it to the feed house. Don't go with the sack inside the feed house. Okay. Then crates and white beds. Okay. They could also be infected via body fluids of other birds, right? That is like a secretion, the excreta, the fluid coming out of their breath would also infect other birds. Then when it comes to treatment, there is no treatment for it yet. There is no treatment for Newcastle disease yet. So you guys be warned in case someone tells you he has a treatment for Newcastle disease. There is no treatment. Okay. Then what you can do is give them antibiotics for 3 to 5 days. This is not for treatment. It is for prevention of secondary infection. When I mean secondary infection, when the Newcastle disease attacks your bird, it's going to bring down their immunity, and other infection can enter their body. Most probably bacterial infection can enter their body. So that is why you need antibiotics, so that any other secondary infection can be prevented. Okay. Then prevention of this Newcastle disease is majorly by vaccination. Also, you need to keep your surrounding good. That is good sanitation. Then implement a very good biosecurity program. So the next disease we are going to discuss is infectious bronchitis. Okay, infectious bronchitis, that is IB, or sometimes called cold. And this disease affects chickens alone. This disease affects chickens alone. Then the clinical signs of this disease: it causes decline in feed and water consumption, that is loss of appetite. Chirping, that is that sound I told you again. You remember I told you some of the symptoms are similar. That's why I did not use pictures. Chirping, that is that quick sound that bird used to make. They find they do it very difficult. They find it difficult to do it. Then watery discharge from the eyes and nostrils. Labored breathing. They find it difficult to breathe. And these are common, most especially in the night when the weather is cold. Then if it's a laying bird, the egg production drops. Then the eggs, the shell of the eggs will become rough. Then the egg white will become watery. Then transmission of infectious bronchitis is okay. It is very contagious. It is spread by air. It is also spread by feedback. You can see feedback is coming here again. So people should know what you should take seriously on your farm. Those feed you get from somewhere, bring it to the farm. It's better you treat the bag with great care. Okay, treat the bags with great care. Then infected dead birds. Then infected house and rodents. Please avoid rodents on your farm. Rodents are rats. Okay, any kind of rat at all, avoid them on your farm. Then can also be transmitted by eggs too. Okay, that is from mother to the chick. But it is stated here that, however, the infected embryo usually will not hatch. So it is usually in the egg, but it will not hatch. Then there is no treatment to it also when it comes to treatment. No treatment to it. Then antibiotics also can be used within for like 3 to 5 days, so as to stop secondary bacterial infection. I've explained that before. Okay. Then prevention is majorly by vaccination. Then also you establish and enforce a good biosecurity program. Okay. Then the fourth disease we will discuss is avian influenza. This is most dreaded. That is what is called the bird flu. We all know about bird flu, right? It is called avian influenza, bird flu. Very, very dangerous viral disease. Okay. Now the species affected is almost all birds. Almost all birds. Then the clinical signs, it could be mild or highly pathogenic, right? The mild form produces weakness, loss of appetite, respiratory distress, diarrhea, drop in egg production, and low mortality. That is for the mild form. Then for the highly pathogenic form, it produces facial swelling, it causes blue comb and wattle, then dehydration with respiratory distress. You can observe dark red or white spots developing on the combs and legs of the birds. Now there could be blood tinged, that is, you can see small particle of blood in a discharge that is coming out from their nostrils. Then mortality can range from low to almost 100%. So this is the most dreaded poultry disease in any farm at all, not in a farm alone, in any state, in any nation of the world. This is a dreaded poultry disease. Okay, it can cause decrease in egg production and hatchability. Then there can be increase in production of soft-shelled egg or shellless eggs. Transmission would be improper disposal of infected carcass and manure, contaminated shoes, clothes, crates, and other equipment. Okay, insects and rodents may mechanically carry the virus from infected poultry to a susceptible poultry. So if you have a poultry that is close to you, insects can go to that poultry, perch on that poultry, and also come with the virus to your poultry. Or maybe a rat can go to a poultry that is infected, feed on anything there, come to your poultry to feed also, and it will transmit the virus to your feed. Okay. And there is no treatment for AI, for avian influenza, for bird flu. There is no treatment for it. Then a broad spectrum antibiotics may reduce losses from secondary infection. That is for the mild one, I think, because I think the highly pathogenic one is very deadly. So this one will not work. Okay. Then prevention is by vaccination. So there is vaccination for bird flu. Then strict quarantine measures for mild form infected birds. But if it's for the leather form, then rapid destruction of all infected flocks remain the only effective method for stopping AI outbreak. So you can see this is very deadly. So the only solution is to destroy the entire flock. Apart from destroying the entire flock, burying them should be under strict measures. They should be buried properly or they should be incinerated properly. Okay, before we go to the second part, before we go to part 2, in case you've not subscribed to this channel, please subscribe to the channel. Hit the notification icon so that you get notified whenever I release a good video like this. Then don't forget to like the video. Don't forget to leave comments. I like comments a lot. I reply most of my comments immediately. Okay, so let's make the comment section as interactive as possible. And don't forget, if you do all this, it's going to help YouTube algorithm push the video out to more people. Okay, I believe this video is going to help a lot of people. So let's do that and let other people also get the message. So now let's continue to part 2. You remember part 1 is viral respiratory diseases, right? Now in this part 2, we are going to talk about bacterial respiratory diseases. Those are diseases, respiratory diseases that are caused by bacteria. And that will lead us to the number 5, which is infectious coryza, IC or ROOP. Okay, the species that are affected are chickens and guinea fowl. The clinical sign is swollen around the face. You can see that this clinical sign is common. I think I've mentioned it in 3 poultry diseases now, right? Then foul smelling, thick and sticky discharge from their nostrils and eyes, right? Foul smelling, thick, sticky discharge will be coming out from their nostrils and eyes. They will have labored breathing with abnormal breathing sound. It will be difficult for them to breathe and you'll be hearing the abnormal breathing sound. Then the eyelid are irritated and may stick together. So anytime you go to a farm and you find a bird with the eyelid closed together, not open, then this should be suspected. Okay, infectious coryza should be a suspect. Then the birds may have diarrhea. Then growing birds may become stunted. Those are the birds that are still growing. They may not grow very well again. Then if you have a laying bird, it will have low egg production. Then here they say mortality is usually less than 20%, but sometimes it gets to 50% depending on the severity and or secondary infection. Meaning if it has a secondary infection added to it, it's going to increase the severity. Then transmission of infectious coryza, it can be direct bird-to-bird contact with infected birds, right? Infected birds can cause it, or birds that have just recovered from the disease. You understand? So if they recover from the disease, most times they still remain a carrier of the organisms and they can still be transmitting the diseases. All right. So through inhalation of airborne respiratory droplets can also cause this disease. It can be transmitted in that manner. Then contaminated feed and water. So if you have a sick bird that is feeding in the cages with other birds, they are going to contaminate the water and the feed, and the other bird can contact the disease from there. Then the treatment, since it's a bacterial disease, definitely we can use antibiotics to treat them, right? Yeah. So water-soluble antibiotics or antibacterials can be used. For example, sulfadimethoxam is a preferred treatment, but if not available or effective, sulfamethoxam, erythromycin, or tetracycline can be used as alternative treatment. And the prevention of this disease is good management and sanitation. Then avoid mixing flocks. Don't bring old flocks and mix them with new one. Don't get flock from another farm and come and mix it with your flock immediately, right? Then vaccine is available and it is administered under the skin on the back of the neck. Each chicken should be administered 4 times starting from 5 weeks of age, with at least 4 weeks interval between injections. Vaccinate, then they say, then vaccinate again at 10 months of age and twice a year thereafter. Okay, so guys, this is what I have for you today. I'll be discussing the part 2. Okay, I told you I divided them into respiratory and non-respiratory, and I also categorized them into by the organisms that causes the disease, which is viral, bacterial, and parasites, right? So we've discussed viral respiratory and we've discussed bacterial respiratory, right? So in the next video, we are going to be discussing viral non-respiratory and bacterial non-respiratory. Okay, so just stick around, hit the notification icon, subscribe to the channel so that when that video comes out, you'll be the first to be notified. And this document is very helpful. I'll leave a link to it in the description below. You can download it. Okay, then also I told you I run my farm. I'm in the Middle East and I run my farm in Nigeria. I have put system in place. I also have that document in the description. You can download it. You can use it on your farm. It is going to help you. Okay, then you are going to see a video on the screen, somewhere on the screen right now. It's going to tell you about how to identify diseases from poultry droppings. I've made that video some times ago. So you can also use poultry droppings to identify the different diseases. So it's also going to help you, right? So get that document in conjunction with this one, right? So this is just part 1. Look out for part 2 coming soon. Okay, thank you guys. This is Oche Inaligu Leonard from Broiler Farms. I'm out.